Welcome to part 5 of Module 2. Finally, you had arrived on the last part of this module. At the end of this presentation, you should be able to identify the names of the bones of the pelvic limb as well as their specific parts. The bones of the pelvic limb includes the os coxae, the femur, tibia, fibula, tarsals, metatarsals, and digital bones. You might notice that each bone of the pelvic limb has somewhat counterpart bone in the thoracic limb. And like the bones of the thoracic limb, they are part of the appendicular skeleton. The first bone is the os coxae or the pelvic bone. Here is a dorsal and ventral view of the os coxae. It is composed of fused ilium, ischium, pubis, and acetabular bone. Acetabular bone is in the center of the acetabulum and fuses early, leaving no indication of its presence. Here is the acetabulum. It is a concavity articulating with the femoral head to form the hip joint. The pelvic symphysis is the junction of the right and left os coxae, while the obturator foramen is a large opening at the floor of the os coxae. This is the largest foramen in the body. The ilium is the largest and most cranial part of the os coxae. It consists of a wing or iliac wing and a body or an iliac shaft. The ischium is the most caudal part of the os coxae. The ilium is composed of a body and a flattened ischiatic table. The pubis is the smallest of the three pelvic bones and forms the cranial part of the floor of the pelvic cavity. There are also three bony processes of the os coxae that you need to locate. First is the tuber sacrale. This is the medial process of the wing next to the sacrum. Next, we have the tuber coxae. This is the palpable prominence on the lateral wing. This is also known as the hook bone. And finally, here is the tuber ischiadicum. It is a thick caudal part of the ischium providing attachment for caudal thigh muscle. It is also known as the pin bone. After the bones of the hips, we move to the bone of the thigh, which is the femur. This is the heaviest and the largest bone of the skeletal system. The proximal end of the femur has a nearly spherical head that articulates with the acetabulum of the os coxae to form the hip joint. A depression at the head of the femur is called fovea capitis. It is present for the attachment of the round ligament of the femur. The greater trochanter or major or lateral trochanter is a large prominence lateral to the head. On the other hand, a prominence distal to the head is called lesser trochanter or minor or medial trochanter. The trochanteric fossa is a depression between the greater and lesser trochanters. A third trochanter is a prominence on the lateral side distal to the greater trochanter. The body or shaft of the caudal side of the femur has two longitudinally arranged ridges with middle and lateral lips. The distal end of the femur terminates into two spool-like articular prominences, the lateral and medial condyles. The two condyles are separated by the intercondylar fossa. At the cranial surface of the distal end of the femur, we can see patellar surface or femoral trochlea. This is the groove articulating with the patella. Above the lateral and medial condyle, sesamoid bones fibula are found. This is unique in dogs. At a lateral view of the stifle joint, we can see the patella. This is the largest sesamoid bone in the body articulating with the patellar surface of the femur. A sesamoid bone associated with the popliteus muscle is also known to be present in dogs. This should not be mistaken for a chip fracture in radiograph. The bones of the leg include the tibia and the fibula. Tibia, or the shin bone, is a long, thick bone that lies at the medial side of the leg. At the proximal end is a process called tibial tuberosity. This is where muscles and patellar ligaments are attached. The tibial crest or the cranial border is a ridge-like structure distal to the tibial tuberosity. Medial and lateral condyles are the relatively flat and triangular-shaped proximal end of the tibia. These bear articular surfaces that meet the corresponding condyles of the femur. The medial malleolus is the distal end of the tibia. On the other hand, fibula is called the calf bone. It is a long, thin, and laterally compressed bone of the leg. It is smaller than the tibia and lies on the lateral side of the leg. The head of the fibula is the proximal end. Lateral malleolus is the distal end. Like with the radius and ulna, the space between the tibia and fibula is called the interosseous space. Like in the carpus, the tarsal bones of the tarsus are arranged in two rows. The proximal row consists of two large bones, the medially located talus or tibiotarsal bone and the calcaneus or the fibular tarsal bone. The distal row is named as first tarsal bone, second tarsal bone, third tarsal bone, and fourth tarsal bone. In between the two rows is the central tarsal bone. Schematically, here is the arrangement of the tarsal bones in dog. Talus is the second largest bone of the tarsus that forms the mobile joint with the tibia. It has a head, a body, and a neck. The body has a distinct trochlea. The calcaneus or the fibular tarsal bone or the heel bone is the largest and longest bone that projects proximally and caudally to form the point of the hock. The calcaneus acts as a lever for the muscles extending the hock. Calcanean tuber is the proximal half of the calcaneus for the insertion of the common calcanean tendon, or commonly known as the tendon of Achilles. Here are the bones of the metatarsal bones and the bones of the digits of the pelvic limb. The pattern is almost the same as in the thoracic limb. However, the metatarsal bones are longer than the metacarpal bones. The shortest metatarsal bone, which is metatarsal bone 2, is as long as the longest metacarpal bone. And that ends our lecture on the skeletal system. At this point, I hope you gain a lot of information as you encounter numbers of anatomical terms and nomenclature applied to bones. Please be familiar with them as you will be needing the names of the bones on modules on arthrology and once you start to study muscle origins and insertion. To assess your learning, a short quiz is prepared for this module. After that, you may now start Module 3, which is arthrology or the study of the joints.